Administering medication orally. Gather the equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer. Enter passcode and scan employee identification if required. Prepare medications for one patient at a time. Read the medication administration record and select the proper medication from the patient's medication drawer or unit stack. Compare the label with the MAR. Check the expiration dates and perform calculations if necessary. Scan the barcode on the package if required. Prepare the required medications. For unit dose packages, place unit dose package medications in a disposable cup. Do not open wrapper until at the bedside. Keep the narcotics and medications that require special nursing assessment in a separate container. For multi-dose containers, remove tablets or capsule from a multi-dose bottle. Pour the necessary number into the bottle cap and then place the tablets in a medication cup. Break only scored tablets if necessary to obtain the proper dosage. Do not touch tablets with hands. For a liquid medication in multi-dose bottle, pour liquid medications in a multi-dose bottle. Hold the bottle so the label is against the palm. Use the appropriate measuring device when pouring liquids. And read the amount of medication at the bottom of the meniscus at eye level. Wipe the lip of the bottle with a paper towel. When all the medication for one patient had been prepared, recheck the label with the MAR before taking them to the patient. And replace any multi-dose containers in the patient's container or unit stock. Lock the medication cart before leaving it. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient using the 3 methods and compare information with the MAR. Check the name and identification number on the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with the staff member who knows the patient for the second source. Complete necessary assessments before administering medications. Explain the purpose and action of each medication to the patient. Assist the patient to an upright or lateral position. Administer medications. Offer water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Ask whether the patient prefers to take the medication by hand or in a cup. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Leave the patient in a comfortable position and perform hand hygiene. Check the patient within 30 minutes or time appropriate for drugs to verify response for medication. Document procedures into the patient's chart.